Meaningful Use Report number 22, Medication Reconciliation. Objective: the EP who receives the patient from another setting of care or provider of care or believes an encounter is relevant should perform medication reconciliation. Measure: the EP performs medication reconciliation for more than 50% of transitions of care in which the patient is transitioned into the care of the EP. Denominator: number of transitions of care during the EHR reporting period for which the EP was the receiving party of the transition. In the WRS system, this is measured by the number of unique patient encounters that had a valid incoming referral in the referral system. It is understood that not all transition of care will be associated with an incoming referral. However, for the purpose of this measurement, this is the only way that the waiting room solutions can log or measure those patients that qualify for the incoming transition of care as per meaningful use requirements. Numerator: number of transitions of care in the denominator where at least one medication reconciliation was performed. Exclusion: an EP who is not the recipient of any transition of care during the EHR reporting period. Transition of care: the movement of a patient from one setting of care, hospital, ambulatory primary care practice, ambulatory specialty care practice, long-term care, home health, rehabilitation facility, to another. If there are transition of care not logged as an inbound referral in the WRS system, then the practice will need to track these by some other means. Medication reconciliation: the process of identifying the most accurate list of all medications that the patient has taken, including name, dosage, frequency, and route, by comparing the medication record to an external list of medications obtained from a patient, hospital, or other provider. Let's first look at the report before there are any transitions of care. Now I will log an incoming referral through patient management. Now add a new referral. To include this patient in the denominator population, a note will need to be created. Now that a note is created, let's go back to the Meaningful Use Report. We now see that the denominator has increased by 1. The numerator is still 0 because the medication reconciliation has not been performed. Now I'll go back to the note to Reconcile Medications. We need to go to the Medications page to reconcile the medications. Reconciliation is done for reported current medications. I'll select the medications that I will reconcile. Now I'll click the Reconcile button, which logs a reconciliation action for all of the selected medications. We now see the medication reconciliation logged with a time-date stamp, as well as the user performing the reconciliation. Now I'll go back to the Medication Reconciliation Meaningful Use Report. We now see the numerator has increased by 1 to reflect the medication reconciliation for this transition of care.